All right, we're going to get started because I know everybody's time is very precious, and I am very excited to hear the topic for today. So, we have Miss Ashley Rosser. I read your bio, and you have an amazing story that I would love for you to tell because I feel like it's more impactful coming from the person that experienced it. She is here to talk to us about cold caps. So, I would love to hand it over to you, Miss Ashley, and give us a little bit about you, whatever you want to tell us, and then I would love to hear about all of this.
Absolutely. Thank you so much. So, thank you very much for having me. This is something that I'm super passionate about. It's something that, 3 years ago, I didn't even know existed. And so, even 2.5 years ago, I didn't even know that this existed. And it's something that, for me, I believe changed the course of just kind of my outcome in treatment in general, the way that my family was able to kind of to get through a very difficult time. So I appreciate the time tonight to be able to share that with you as people who are kind of front lines dealing with physicians as well as patients constantly. So I was an extremely healthy 40-year-old business owner, mom of 3 children. So my children right now, they are 18, 16, and 12. At the time, my youngest was 9. And so I was very healthy. I had done a full Ironman. I was training for a full marathon. In fact, I actually wound up running the Philadelphia full marathon 3 days after I received my diagnosis, which I'll talk about that in a moment. Yeah. So I really felt like I was kind of in the best shape of my life. And so 40 years old, to be responsible, I was needed to get my mammogram. So I turned 40 in April and had been kind of just sitting on the counter for a while. And then I saw a friend who I had worked with formerly. So my initial career, I was a nurse at the Children's Hospital of Philadelphia, where I worked in the emergency department for 10 years. And then back in 2009, I had began a transition where I began working with my dad doing retirement planning. And so I've actually had a complete career shift I now own the practice completely 100%. But one of the nurses who I'd worked with had posted about like her journey that she'd been diagnosed with breast cancer. And I remember it just grabbed me where I was like, wow, like, you know what? I'm not leaving for work until I make this mammogram appointment. Went in, had my mammogram, didn't really think anything of it after that. And then I, got a call that on that first screening mammogram that there was an abnormality, had to go back in. And, after a few weeks of testing, found out that I had stage 1A invasive ductal carcinoma. And so was it was completely shocking, completely devastating. And I wound up so that was November of 2022. Like I said, so I was diagnosed on a Thursday. I ran the marathon on a Sunday. And by the end of that marathon, I had made my peace with the fact that, nothing is going to keep me. Nothing's going to kind of stop me. That was kind of like my F you at that point to cancer. Like, you're not taking anything from me at this point. And so that was November. January 4th, I had a bilateral mastectomy. And we were hopeful that would be all that I would require. Unfortunately, I had a high oncotype that came back. And so the recommendation was for chemo. And again, it was shocking again all over, because I had kind of been like psyching myself up that this is going to be all that we'll need. And not only did I need chemo, but they decided to do a pretty aggressive regimen. I wound up getting 16 rounds of chemo, 4 of the adriamycin cytoxin schedule, which you may be familiar with, is known as Red Devil. It's a very aggressive. And I remember being like shocked, like with my doctor, like, I mean, I need like real chemo. Like, I guess I was in my mind had told myself that if I needed it, it would be like baby chemo. Like, I'll just get like a couple and it'll be fine. And she was like, yeah, you know what, if we're going to do this, you're so young, your features of your tumor were so aggressive. We think that we need to do this. And so I'll never forget, I tell the story all the time. My doctor looked me right in the face and said, you will lose your hair. Here's your script for your wig. Like, all in the same sentence. It was very like matter of fact. And I was still trying to come to grips with like everything. And so I had just happened to hear about cold capping in a other group for breast reconstruction, actually. Just somebody like randomly brought it up. And I mean, I had been a nurse. I considered myself pretty well educated, and I had never heard of this, never seen it. I knew a lot of people who have gone through chemo. Nobody had ever talked about this thing called cold capping. And so I asked my doctor, I said, well, I'm interested in cold capping, I think. And she was like, oh, well, that won't work for you. That your adriamycin Cytoxan regimen is very, aggressive. There's no success with that. I probably wouldn't waste my time. And so I said, well, I hear what you're saying, but I think I'd like to give it a try, or at least find out about it. So they went back, and like 10 minutes later came back with a pamphlet that was like torn and dusty and clearly had just been shoved in a cabinet for years. And they like gave it to me, and I was like, all right, I kind of realized I'm on my own with this. So I went home, and we had to tell our children that I was going to get chemo. And, the doctor had really discouraged me at that point. And so I wasn't sure if I was going to do it. And I remember telling the kids, and my 9-year-old at the time was like choked up, and he said, are you going to look sick? And I said, I don't know, buddy. I might look sick at some point, and he said, are you going to lose your hair? And I said, I think so. And I'll never forget it. As we were walking up the stairs, he like grabbed onto me and he said, promise me you will never not wear a wig around me. And in that moment, I realized the terror that he felt about his mom looking sick, and it scared him. And that was when I told my husband, I said, you know what, let's try. Like, at least I can go down swinging. If it doesn't work, at least we know that we gave it all. And so I did research, and I researched all of the companies. It kept coming back that Penguin had the best outcomes. They were actually the first cold capping company they're out of London. They've been around for 25 years. And that really shocked me when I thought, how am I this is not new technology. Like, this is not new. How has this been around for over 20 years and nobody knows about it? My medical team couldn't give me any education about it. I was treated at a very well-known medical facility. I was at MD Anderson in South Jersey. Team, I feel like I had the dream team, but it wasn't a priority. It just wasn't, it was just expected. You're going to lose your hair. Here's your script. It's okay, next. And so again, I did my research, and I spoke with a bunch of different companies, and I wound up going with Penguin. And as a result of capping with Penguin, I maintained about 85% of my hair through all 16 rounds. And so I'm going to show you guys my before and after pictures, because I think it's really telling. But, what I always tell patients, and so as a result, so I had this incredible, outcome. And it really, I feel like, affected my journey in general, because every morning when I woke up, I looked like myself. I didn't look like a sick person. Like, when I look back now, I'm like, oh my gosh, like, I had no eyebrows. I was pale. I had moon face. But when I looked in the mirror, I looked like me. And so I never felt sick. And so, there were times that maybe I was tired, or that, I needed to rest, but I worked the whole last 12 weeks of chemo when I was just receiving Taxol, because I felt well. I never missed a swim meet. I never missed a soccer game. I never missed a wrestling match. I was there, and it was really empowering to be able to do things like to go volunteer at my children's school and to just look like every other mom. And I distinctly remember a time when my daughter had semi-formal pictures, and I was able to go. And I remember I wore masks because there was a lot of people there, and my white count was really low. But everybody at that point, people were still masking for different things. So it wasn't like a big deal. And I remember just being so grateful. Like, nobody here knows that, like, I'm not Allie's mom with cancer. I'm just Allie's mom. And I remember thinking I was so grateful for that. And so went through my treatment. Every time I went in, now at first I felt like nursing was a little pessimistic. They were kind of maybe a little annoyed at times with things. By the end, though, they were piling into my room to see me, to look at my hair. Like, they were just like, man, like, this is incredible. I wore a costume to every treatment, which I will show you as well. And that was one of the ways that I tried to bring a little bit of like levity to the situation. So I'd be like sitting in the waiting room with a full head of hair, And like, why are people staring at me? And then remembering, because I'm dressed like a Christmas tree or like whatever, it was. But that was something that I did to kind of help me get through treatment. But my medical team became believers. My nursing team, they were like, man, like this is a miracle. And I remember thinking, yeah, but how many other patients could have had success with this if they had known about this? I just happened to find it. It was never mentioned to me. It was never brought up to me. I just happened to stumble upon it. And even when I asked about it, it was, I don't think it's going to work for you. And so I really felt grateful that I'd had the opportunity. So with all of that, I wound up getting connected with Penguin. And so Penguin reached out to me and asked if I would be interested in basically having a territory. So I have a territory in the greater Philadelphia area is where most of my patients are from, and we are able to provide capping assistance, which I'll talk about. But I'm very passionate in general about getting this out in the United States, just in general, because, most women, when they find out they need chemo, there's two things that they talk about. They're worried about, that they're going to be sick, and they're worried about losing their hair. And we don't have to lose our hair anymore. And so like, I had this tagline of like, cancer already takes so much, but we don't have to let it take our hair. And to me, that really rings true because it gave me a sense of control. It gave me something that like I was able to keep I was able to preserve that dignity. And again, to be able to wake up in the morning and to see myself in the mirror, I can't even tell you just how powerful that was. So that's kind of my story with cold capping. It's how I got connected with Penguin. And so right now we work with patients. So they call me if they get kind of plugged into me based upon where they're getting treatment, and I'm able to give them education and teach them about the caps. And then we have professional trained cappers through our company. So I founded Compassionate Cold Capping, which is my company that allows us. So we go into medical facilities, we go into infusion wings, and we go into inpatient places if patients are getting bone marrow transplants, and we provide capping services. So we either can train loved ones on how to do it, or some patients just hire us to do everything. So I'll kind of pause there and see if anybody has any questions, and then I'll kind of move on to what capping is and how it works. Okay. So I am going to share my screen here. Okay. So what I'm actually going to do, we're going to start here. We'll come back to so the way that it works, so cold capping, the idea is that we want to shut the hair follicles down before the chemo begins infusing. And so the caps are extremely cold. So ideally we're between like -32 to -40 degrees Celsius. So very cold. The caps are capped on dry ice. And the idea here is that we want to start capping before the infusion begins to allow the follicles to kind of get shut down. So it's usually about 50 minutes before your infusion begins. This can be done through their pre-med time. So a lot of times patients are getting Benadryl and other things. So they can actually that can be part of their pre-cool time. And then we cap through the infusion the entire time. And at that point, we are changing the caps out every 25 minutes. And so the most important thing here is making sure that the caps are the right temperature and that the caps are properly fitting. And so it's not rocket science. It's just something that we have to have a procedure that we follow. And as long as we are able to follow the procedure, then patients have extremely good outcomes. And then we do need to post-cool for a period of time after the infusion, because even though the infusion is finished, that chemo, it takes some time for our bodies to break that down. And so depending upon the regimen that the patient's receiving, that kind of will dictate how long they need to post-cool for. Typically, it's going to be anywhere from 3.5 to 5.5 hours. The more aggressive the treatment is, then the longer we could be post-cooling for. But the beautiful thing with Penguin is that since it's manual, we can post cap as long as we need to, and we can go anywhere. So your patients can literally just up and go. Now, what my husband and I would do, since we were changing them every 25 minutes, we stopped off at the same fire department every time on the way home to put a fresh cap on so that we weren't like pushing it. I have patients though that we go with them, they go to Starbucks, they go to Panera, like it can go anywhere. And as long as we're changing them on the schedule, it really doesn't matter. So that is one thing that's really nice. So the machine-based cooling programs tend to not have as good of outcomes because they don't get as cold as manual caps. So the machines, they have a coolant that kind of flows through them in the cap, and they can't post cool for as long as we can manually because ultimately they need those chairs at some point. So you can't post cool for 5 hours at the infusion wing like we can with manual caps. And so so that's really how it works. And again, the biggest thing, and I guess the biggest wild card, is just making sure that whoever is changing the caps out has been properly trained. Because as long as they know how to make sure the caps are the right temperature and how to get the proper fit, patients will do very well. And we only have to cap during the infusion, like during our chemo days. We don't have to do anything afterwards. And I will talk briefly about the hair care that's required after. And so what I would like to do here. So here we have me and my husband. And now remember, I told you that I wore costumes. So I am going to show you guys me as Batgirl. And this was just a sped up video, kind of just showing. So there's gauze on my head to protect my head. It's a sped up video, but just kind of showing that it's not a complicated process. It's a matter of those 2 straps and then the gel headband. And then what I'm going to do is, now this one is not sped up. So let me just drag this out of my way here. So for this one, this was normal. So this was actually my last day of chemo. So you can't really see my hairs behind me, but I'm going to show you guys what my hair looked like. So this is my husband doing it in real time to just kind of show. Now this is the first cap. I take a deep breath because it's very cold, that first one. I used to joke that, my husband knew, don't talk to me, don't breathe near me for like the first 5 minutes. And then after that, I was fine. Because your head does get used to it, but that first cap is cold. And just to kind of just show it's not complicated. And once you have the process down, and he had already checked, and I'm using an electric blanket here, and he had already checked the cap temps with a infrared thermometer gun. And then, so that was it. So if patients are worried that like, oh, is it going to be too complicated? It's really not. I mean, we can teach patients over Zoom if we need to. So that is, it is definitely, it's manageable in terms of how to learn. And then what I'd like to kind of show you now is just kind of what my journey was. And are you guys still able to see my screen? So these 2 pictures here, so these were pre-chemo. These were like pretty much immediately prior to my diagnosis. And so we took pictures at every treatment, just kind of showing the progression here. And as you can see, as the treatments continue on, I mean, my hair just continues. I mean, it was pretty wild. So as I was going through, now after those first 4 treatments, I was receiving weekly Taxols. So weekly Taxols are much less aggressive on hair. In fact, we got to the point of the Taxol treatments that I was having regrowth. So even though I was still receiving chemo, the cold caps were protecting my head, my scalp, and I was actually having hair. So when I finished my treatment, I actually had the hair that I had lost around my ears was growing back. And so that was pretty cool. And this was my last day of treatment where I said Ironman 21, marathon or 22, but my hardest race yet was beating breast cancer in 23. And so here you can kind of see where my hair, but this is what was so telling. So this is 3 months and 6 months post chemo. And so I had lost the hair around my ears because it is hard for the caps to lay flat because of your ears. And I had lost some hair around my hairline here, but it was all very easy for me to kind of disguise at that point. These are pictures that I share with patients all the time, just kind of letting them know, like, hey, as a real person who's, gone through this, it, it can work. Obviously, if you have a patient whose, liver has been compromised, anything that might make it harder to clear the chemo from your system has the potential, obviously, to impact. Another thing, BMI does have does play into success rates. So patients with high BMIs sometimes struggle to clear chemo as quick. And so sometimes that can have an effect, but we have seen incredible success. And so something that people ask me about sometimes also is, what has our success been with African American patients? And so obviously their hair has a different texture than maybe my hair would be. And so we've actually had really great success, even really with all types of thickness and different coarse types of hair. And so we even have a patient right now who is capping with locks. And I really was like, I've never seen it done. I don't know, because it pulls your scalp is going to be pulled. There's going to be a lot of like kind of bare areas. And she's maintained about 70% of her hair, which is, to me, is fantastic. So I think that the biggest thing that I would like to get across to those that are out in the oncology community is, this is something that I firmly believe every patient, we have had men cap with us as well. We've had a couple of men who are, in large companies, and they just didn't want anybody to know that they were going through treatment. We've had female doctors and surgeons who decided they didn't want to tell anyone that they were going through this, and nobody knew. We had a surgeon from Jefferson who actually flew home to India for a wedding and hadn't told anyone that she was going through treatment for ovarian cancer. And she said nobody knew. She was able to go and do that. And so just the fact that we can provide, so it's not even just women, it's just patients with the ability to protect their privacy, protect their dignity, and give them a sense of control. Cancer sucks. There's no other way to describe it. I feel like daily, I still deal with the trauma of cancer in my diagnosis and treatment, and I deal with the physical ramifications of chemo, and then the hormone blockers that I'll be on for 10 years. But I am so grateful that what might seem like a small piece to some people was so huge that I was able, when I finished treatment, I rolled right back into being me. There was no period of time where I continued to look sick. So that's really what I was hoping to share. I would love to answer any questions if anybody has any, but I appreciate you taking the time to listen.
I predominantly work with blood cancer patients and bone marrow transplants, and I picture in my head so many people who probably would have been interested in something like this. I don't know if our hospital even gives them information on this. I've never seen it. In the year that I've been there, I've never seen anyone do this. And frankly, we have a beautiful setting for them to be able to do the post-treatment care. I mean, they could be right in we have a beautiful atrium. They could sit there as long as they want, because we have an inpatient area also. So the building's always open. But it's so nice to know. I guess probably my biggest question right now that I can think of is, what's the best way for us to be passing along this kind of information, especially if we're in a setting that is hospital type setting. That's where I work. I don't work with private patients. So, obviously having to understand the bureaucracy and all of that of my center,
Yeah.
I'd still love to be able to kind of have some information maybe in my pocket for people to be concerned about this.
What part of the country are you in?
I'm in Southwest Ohio.
So, what I can do certainly is probably the best thing to do. Now, do you ever have interactions with physicians or nurse navigators? I personally think the navigators are probably a great resource because a lot of the times they're kind of doing the other education and things.
Mm-hmm. A number of them, probably more the nurse practitioners than outside of our nurses, because they're the next line after the doctors.
Mm-hmm.
Because I'm a massage therapist in our building, I go everywhere and have a lot of interaction. I mean, our medical director is someone I can pass in the hallway and, be like, oh, but I think the big piece of this that I really love is, even though it's, so cold and everything, it's otherwise non-invasive. And our center, so I work for the holistic arm of our hospital within our healing center. So
Mm-hmm.
we are all about bringing holistic elements to what these patients are going through. And I feel like this is kind of a part of that. It's really, if we're really going to treat the whole person, we have to treat the whole person and take all of these things into consideration. And this is one of them, because I see these patients and what they feel like when I'm going in to do a massage for them and their hair is falling out. And they're like, no, it's not just here or there. It's like, and you can see the shirt is just covered. And it doesn't bother me, but I can see the expression on their face. I can hear it in their voice that, and it's not always, but it's enough that this is something that is heavy for them. So
Sure.
yes, I would say probably our nurse practitioners, probably a number of people even within our holistic arm. I'm not 100% sure who the right people would be, but I just feel like somebody could probably tell me, hey, when you provide information at a new diagnosis and you're giving them an idea of, what their chemo regimen is going to look like, do you provide this kind of information?
Yeah, and I'm going to guess that if you're not seeing patients cap, they probably aren't. And that,
Never.
like I said, I mean, I was at an MD Anderson location. The entire 16 rounds that I was there, I never once saw another patient capping. And so for me, that was pretty huge. I realized, like, man, like we are just so behind here. And so I love the fact that you're with a holistic department, and because 100%, I mean, I can tell you as a survivor, me looking in the mirror and seeing myself as not a sick person, I 100% believe drove my treatment journey to be so much smoother because I never looked sick. So I never really felt sick. I mean, there were a couple of days that I lay down in bed for like a little bit, but I mean, I was running 6 miles a day when I could. And why? I was riding my bike, I was riding my trainer. And again, like I said, I never missed a swim meet or a wrestling match because I didn't feel sick. Like I kept waiting kind of like for the shoe to drop. I kept saying, okay, well, I feel good today. And I strongly believe that when you're able to just kind of look, and again, I'm not sick. I don't look sick. I don't feel sick. Like I'm good. That is huge. And I think that we've really missed that in the US. And so the one thing that I'm encouraged about when I was diagnosed in 22, no insurance company was covering this. This was not covered at all. And now the state of New York and the state of Maryland have passed laws since then requiring cold capping to be covered by insurances. And many of my patients are getting reimbursed for both the rentals as well as even our capping services. And so for me, that's a sign that the country is beginning to like embrace, but I feel like we're still at the very early stages of this. Certainly, I am more than happy to, if anybody in your center has questions, I'm happy to send you some brochures just for you to have. my website is phillycoldcapping.com. So even just to be able to let them like see, like here, you know, a patient who had AC and had 16 rounds, like now I'm hopeful that as they'll continue to like learn more. I think that physicians are almost like afraid, like they don't want to recommend something that might not work. And so I understand that, but I also feel like we're doing patients such a disservice by just pretending like there's nothing out there.
Well, thank you for all the information. It's great for us to have this, especially when I, daily see people going through this. So at least we're armed with the information.
Absolutely. Yeah. And so I'll make sure after this that everybody has my contact information. So you're welcome to email me or, text me. I'm happy to send anything because like I said, my whole goal here is to just help spread the knowledge because like I said, I didn't even know that it was a thing. And most of my world now is starting to share it, but they only know it because I was open in my my journey. So anything I can do to help get the word out is it's important to me.
So I do have a question, and I'm in Texas. And so some hospitals offer, I guess it's the machine cold cap. I honestly didn't know there was a difference until today. So, so thank you for that. If somebody wants the option of, I guess, the head wrap, is that doable? Like, because you're not close to me.
Sure. So I would say, like, you mean like if they offer the machines?
Well, like if one of my clients or says to me like I want to do cold capping, but they only offer this one thing, and I have an option for them like your information, are they able to get that in Texas?
They are, yeah. So this is all across the country. So yeah, so Penguin is available in all 50 states. Yep. And yeah, so absolutely they are. And I think that, like I said, we just want to just kind of keep getting, the word out. So yeah.
Any other questions pop up? This is very awesome.
And I just love to talk about it. As you can see, I could just, again, it was so powerful for us. And I'll kind of just show you guys here. So I just got my hair cut and
How the Beyonce
highlighted, but I can kind of show you guys my regrowth. So this, if you can see it, so the little bit of hair around, you can see around my ears is what has been growing out now since then. But otherwise, this is basically what my hair looked like when I finished treatment. So,
are there any side effects or any kind of long-term, like what risks or anything like that, especially as far as skin damage or anything like that you can talk about?
Absolutely. Yeah. Great question. Yeah. So and if you saw in the video, I had gauze over my head, and what you might not have been able to see is that my ears were covered. So we actually use like light day pads is actually what we use. And so we cut them to protect for here. And then we cut holes in them so that we can hear. And then the pads are stuck to our ears to protect basically any skin that could be exposed is what we want to protect. And so the gauze is protecting our part line and protecting any potential areas of where we may have had thinness. And then the light day pads is kind of padding the void there. So I would say in terms of now, and we have a pregnant patient right now. So pregnancy is not a contraindication for this. You mentioned like blood cancers. So I've had probably 8 patients inpatient with lymphoma who were getting bone marrow transplants, who we went in and capped them in their inpatient day because they, received their big, and we've had really great success with that. I actually have one of my patients, her daughter reached out to me. Her mom did so well. She wants to be a capper with us because she was like, this is just like so amazing that you guys were able to help my mom like this. But so I would say frostbite or, skin burning is something that it's very rare. It could happen. So it's just important to make sure that we are training family members on how to protect that skin. And just for patients, like if they shouldn't feel like pain, like if there's one spot where they're like, oh, this is really burning my ear, well, we should take the cap off and double check. But in terms of kind of like other side effects, so I have horrific migraines, but this didn't give me a migraine. Like I said, after the first like 5 to 7 minutes, the first 5 to 7 minutes are fairly brutal. I would take an Ativan in the parking lot. I took one Tylenol and an Ativan. And for me, that was kind of enough. And like I said, my husband knew, just let me be. I need a couple minutes to just be in my own space. But then literally I'd be like, okay, what are we going to order for lunch? And that was it. And I was done. And once I adjusted to that temperature, so I'm trying to think, the only, because most like chemos don't even cross the brain barrier, the only risk of, because like some patients will ask like, well, is it a risk for me to like be freezing my head if I want the chemo to go everywhere? The only risk would be if your cancer is known to cause scalp carcinomas, because again, we're not freezing the brain underneath, we are freezing the capillaries that are very superficial on the top of our head. So generally speaking, pretty much solid organ tumors is what this has been predominantly developed for. But like I said, we have a lot of lymphoma patients. And so I've also capped even some pediatric patients who were receiving like stem cell transplants and things. So
Thank you, Miss Ashley. Any other thoughts? You answered my questions while you were talking, so I only had
perfect.
one.
And like I said, if afterwards, if we will send my email and my contact information out. So I know they also, anything I can do would be wonderful.
Well, Ashley, I really thank you for your time this evening, and thank you all for
My pleasure.
joining us. I am excited to get some information to my clients now.
Excellent. All right. Well, I'm available for any questions that come up. So thank you so much.
Thank you all.
Have a great night.